welcome back to the second half of NEWSBREAK Live. Joining me tonight is cardiologist Rishi Kaushal from Providence Medical Institute, South Bay Heart and Vascular Center. Thank you so much for joining me tonight.
You're very welcome. Thanks so much for having me.
And tonight we're talking about a very important topic. February is American Heart Month, and it focuses on spreading awareness about having a healthy heart. As a cardiologist, what do you think viewers should know about during this month?
Well, I think to start with the basics, heart disease is the #1 killer of Americans. Unfortunately, we are making significant headway in terms of improving the number of deaths, but it still remains the #1 killer. First and foremost, patients and people should know their risk factors, such as the presence of diabetes, high cholesterol, family history of heart disease, smoking, and obesity. And visiting your physician to recognize and identify those risk factors is #1, and taking action to prevent the onset of those risk factors if you don't have them, and if you've been identified with risk factors, take action to control those risk factors. So for example, if you have hypertension, make your numbers the best as possible. If you have diabetes, lower your blood sugar, and we can talk about ways to do that as well.
What are some symptoms of heart disease?
They're very broad, and it kind of covers a wide spectrum. There's a lot of atypical symptoms, so we have to have a low threshold, but classic symptoms of a heart attack, for example, includes chest pain, chest pressure, discomfort that can radiate to the left arm, to the neck, to the jaw, or the back. Shortness of breath is a common symptom as well, and that can be a symptom of heart failure or of a heart attack. And stroke, which is a part of cardiovascular disease, is a different set of symptoms. It's kind of correlated to a heart attack of the brain. And it's usually weakness, slurred speech, inability to smile, for example. Those are some symptoms of a stroke.
For viewers who don't know what heart disease is, it can cause stroke and heart attacks, correct?
Correct. When you're talking about heart disease, it's specific to the heart. Cardiovascular disease is kind of an umbrella that includes heart disease and stroke.
And what preventative care can people take?
There's a lot people can do, and it's very basic. I mean, literally just increasing your regular activity day to day, taking the stairs at work instead of the elevator, making healthy choices in terms of what to eat. I usually recommend the Mediterranean diet, for example. That's fruits, grains, vegetables, reduced red meat, reduced saturated fat, and if you're going to cook with olive oil. In terms of other preventative techniques, again, just visiting a regular doctor, get your blood checked regularly. If you don't have access to a regular physician, heart screenings are also a very, very good way to get yourself checked out.
Now that you mentioned heart screening, tell me about that. And should anyone go get a heart screening? Is there a specific age?
Yeah, it's actually, you'd be surprised, but the American Heart Association actually recommends patients in their 20s to start getting screened for heart disease. And that includes a blood pressure check, cholesterol check, family history, identifying those risk factors that we talked about. So really, people in their 20s should start in that process, and what's recommended is every 3 to 4 years. So again, if you have access to a regular physician, that's a great way to do it. If you don't, heart screenings are a fantastic way to do that.
And Providence actually offers heart screening. So if you can tell me a little bit about that program and how people can sign up.
Sure, it's a program that we developed about 3 years ago. It's been very, very successful. There's currently 3 locations that we do it. One is in Torrance at Providence Little Company Mary Hospital. The other is in San Pedro at the hospital there, and one is in Manhattan Beach. It's a fairly straightforward process. It's at a discounted rate, so it's very affordable for most people. And again, it includes some of the basic screening measures, and you actually meet with a qualified healthcare educator who kind of walks you through the whole process and gives you a breakdown of your specific results.
How important is a heart screen?
It's very important. Again, it's crucial to identify your personal risk factors. I have patients, for example, who are in the 30s, marathon runners, very, very fit, who have heart disease, and it's very surprising to them. And if you kind of dissect their history, they have early onset diabetes, or they have a very strong family history of premature coronary disease, for example. So identifying those key risk factors is important so you can take the actions necessary to prevent heart disease down the line.
As a cardiologist, what kind of patients are you seeing more kind of come in and visiting you?
As the baby boomer population ages, we're certainly seeing patients well above their 70s. 70 is the new 40, I like to say. So we have plenty of very spry and active patients in their 70s, 80s, and 90s. And with new medical advancements such as minimally invasive heart valve replacements, we really have good options to treat patients who are older. Also, there's been quite a few young patients I mentioned. You should start getting screening in your 20s. I have quite a large group of patients in their 20s and 30s with true heart disease, unfortunately. So you can never start early enough with these preventative techniques. And a lot of studies have shown actually that everyone starts to develop cholesterol plaque usually in between the age of 10 and 20. Very, very surprising, but it's a process that starts early, so we have to target that early.
I know, I would say it's very surprising to me that someone who's younger would maybe have heart disease. So are a lot of people surprised when you do tell them about that?
Absolutely, absolutely. That's probably the most kind of shock and awe statement is when I give that little fun fact there. But I think it's very effective and it really does drive home a true point. And again, I think the hardest thing for me is to tell a young patient that you've had heart disease or that you're having a heart attack. We have a lot of ways to deal with that, but we have a lot of ways to prevent them from being there in the first place as well.
And for people who don't know, what is the difference between a heart attack, heart failure, stroke? Because if you know the warning signs, the symptoms, you can prevent it.
Right, exactly. So a heart attack, it's usually caused by a narrowing or a blockage in the arterial circulation or blood supply to the heart. So it's almost like if you have a blood pressure cuff that's inflated for too long, your arm starts to get sore and achy. It's not getting enough circulation. That's exactly what's happening to the heart. So the symptoms are similar to that. It's usually chest ache or pressure or discomfort. Heart failure usually results from a weakened heart muscle or inability to pump properly forward, and that can be due to silent heart attacks. That can also be due to valve disease. So a valve in the heart can become restricted, not allowing enough blood flow out, or it can become leaky where it pumps backwards instead of forwards. Symptoms of heart failure are usually shortness of breath, edema or swelling in the legs, and just fatigue in general, inability to do something that you were able to about 6 months ago. And then a stroke we already talked about. Again, it's kind of a heart attack in the brain, usually caused by a narrowed or a blocked artery in the brain.
What about high blood pressure? Can that cause a heart attack or a stroke eventually?
Yeah, absolutely. So the definition of high blood pressure, first of all, is a blood pressure above 140/90. Those are the two numbers, the systolic and the diastolic that we look at. And that is a very, very strong risk factor and predictor for the future development of heart disease. There's a lot of things that we can do short of putting a patient on medicine to control blood pressure. That includes regular physical activity, decreased stress, and also reduced sodium intake. We usually recommend a salt intake less than 2 grams or 2,000 milligrams in a 24-hour period. And if patients apply that, you'd be surprised at how many patients can get off blood pressure medications. Also, if you can achieve an ideal body weight, that would be very, very helpful as well.
What other preventative measures can people take? I think the big thing for viewers to walk away is, I know we talked about heart attack, stroke, heart disease, is that we can actually kind of predict our fate by taking those preventative measures.
Right, and I think it's very basic and simple. It's sometimes harder to do, but again, just regular physical activity, regular checkups, whether it's screening or physical exams, maintaining an ideal body weight, and maintaining a healthy diet. And sometimes, especially nowadays, it's kind of overwhelming in terms of the diet that we can get. There's organic this, organic that, and some of those choices are a little bit more expensive. And there's a study done on average, it's about $1.50 more expensive per day to actually make healthier choices in terms of eating, which is interesting, but I think it's attainable for most people. So I think it's really just the simple things and keeping that in focus. Otherwise, it's very easy to get overwhelmed with all the information out there. So just keeping it very simple.
What would you like viewers to walk away with when it comes to American Heart Month? Why is this awareness so important?
Well, I think, again, one thing that I alluded to earlier, we are making a dent in the numbers. We're actually reducing the proportion of heart disease with treatments and with prevention. And I think prevention is the main thing. But it still, again, remains the #1 killer of men and women. Smoking, also, I forgot to mention that, is a huge, huge deal. And actually in the late 90s, we started making a big dent in terms of smoking and targeting smoking campaigns. And that's when really the incidence of heart disease began to drop. So again, it's easy to get overwhelmed. I think just focus on the simple things, and we really can together do something to lower the incidence of heart disease.
Well, Dr. Kaushal, thank you so much for joining me. It was a pleasure having you.
Thank you so much. It was a pleasure to be here.
And if you'd like any more information, or if you're interested in signing up for a heart screening, go to california.providence.org/Torrance/ be sure to search healthy screening. You can follow Providence, Little Company of Mary, on Pinterest, Instagram, YouTube, and Facebook. Their handle is Providence, California. And thank you for joining me on another episode of NEWSBREAK Live. City Council does have the night off. If you ever have news or video that you'd like to share, please email us at newsbreak@torranceca.gov. And for Facebook and Twitter users, use #NewsBreakLive. We'll see you next time. Have a great night.